Good morning, and thank you for coming. Thank you for joining us.
Your mic.
Sorry?
Mic one, your mic.
So apparently you have to turn microphones on to have a press conference. So thank you for joining us, whether you're online, streaming live, or here in person. I wanted to take a moment. I want to thank everybody for the opportunity to speak to you today about kind of giving you some updates on a hyper-local level of what's going on in Kankakee County as far as COVID-19. But before we get going, I just wanted to take a moment. I want to thank in particular the public for getting on board with this and taking it seriously. We had a few fits and starts at the beginning, but it seems like people have begrudgingly taken their medicine, so to speak, and now they realize, and I hope you'll see in a few minutes, that there has been a benefit to these actions. Obviously, these four people that are here with me today, Phil Kankakee, CEO of Riverside Hospital, and Christopher Schride, CEO of Amita Hospital, John Beavis, the administrator of Kankakee County Public Health Department, and Bob Gessner, Kankakee County Coroner. I very much appreciate your time. They've got some good information to share with you. And I really appreciate what you're doing on a daily basis, because this is, as it's evolving, it's high pressure, it's high tension. There's a very human factor to this, and you also have operational concerns as well. So we do appreciate what you're doing and your teams. It's amazing what you see, how people step up in times of trouble, especially here in the United States. We have a good history of that. So the community leaders that have been in close contact with me over the past weeks, I want to thank you. All the mayors that we've been talking to and trying to communicate on a regular basis so they can get information to their constituents. And I do want to have a special thanks to Steve Hunter and Theotis Pace, who we've talked frequently about what's going on in the African American community, and to provide information and the commitments of some of these gentlemen in those areas we really appreciate as well. I also want to thank my friends, the Sheriff Mike Downey and State's Attorney Jim Rowe for the work that they're doing in this aspect. And our legislators, Senator Joyce and Representative Parkhurst, who have been there for us at any time we need assistance or questions, or we look for resources. Especially at Shapiro, we want to thank them for what they're doing. And then me personally, my team, this whole time this has been going on, what, a month and a half? It only seems like a couple days. But my maintenance director, Wes Andrews, who's directly on the front lines with building, the janitorial services to make sure that we're protecting our employees, and IT director, Kevin Duval, to make sure that we can have all these Zoom meetings that everybody has become accustomed to now these days. Our EMA director, Andy Baston, all of our elected and appointed department heads and their staff, and especially our county administrator, Anita Speckman. She puts up with me on a daily basis and actually keeps me centered, if that's even something possible. So without any more to ado, I think I'd introduce Phil Kankakee, CEO of Riverside, and he had a report from Riverside's perspective. So,
all right, thanks, thank you, Chairman Chairman Wheeler.
Chairman Andy.
Chairman Andy, there you go. And good morning to the folks out there listening. As I sit here today, we opened up our command center 52 days ago. So this has at least been serious enough for Riverside to open up the command center for 52 days. So not quite 2 months, but quite a long time. We've been staffing that command center every day, 7 days a week, 8 to 10 hours a day since then. We did lots and lots of preparation for our patients and for our communities to keep you safe. So we created negative pressure rooms. We created a whole unit, a 42-bed unit that was negative pressure. So as COVID patients came in, we could have isolation areas for those patients and care for them, and also keep them separate from the rest of our patients who still come in who don't have COVID. We did a lot of work in our ED and created additional isolation rooms in our ED, created a separate triage area in our ED just to protect people coming in. What I will say, current state today, we have ample bed space, we have ample ventilators, we have ample ICU beds, right? So not saying this is over, but from an inpatient standpoint, the positive news is we're seeing a decline in the sickest of the sick coming into Riverside. So again, that is very, very positive news for our community. We still have issues out there, and two of those issues really are congregate living facilities throughout our community. So whether it's Shapiro Developmental Center that you've heard about, whether it's Miller Center, our own skilled nursing facility, or others throughout the community, those populations and those folks are the most at risk, and we need to be very, very careful in how we handle those folks. The other big issue I see out there, and I'll speak to this more when it comes to testing, is really asymptomatic patients. What we're finding are patients are people, I won't even say patients because they're not patients yet, people are out in the community and they feel great. As we test them, some of them are coming back positive with COVID, right? So no symptoms at all. They don't have a fever, they don't have a sore throat, they don't have shortness of breath or chest pain. Those are the folks that can spread the disease, spread the virus to other folks, especially the seniors who are most at risk, right? So those are the two big issues out there. With that being said, I want to talk a little bit about our ER. And I had a dear friend call me yesterday, right? Female, in her 70s, I won't say her exact age, I won't say her name, called me. She's had a fever for 3 days. She's had severe stomach pain for almost a week. And she goes, Phil, what should I do? You call 911, you get in the ambulance, and you come to our ER, right? That's what she needed to do. She came in, she had a hot appendix. We did emergency surgery and took her appendix out, and she's great. People are staying at home when they should be coming to our ERs. I hear those stories. I went down to my ER and I was talking to our ER manager. Those stories happen every day. If I get nothing across to anybody out of this press conference, don't be afraid to come to our ERs. So whether it's Riverside or Amita, it doesn't matter. Come to our ERs if you have chest pain. We have people who have come to our ER 3 and 4 and 5 days after having a heart attack. They're afraid to come because they don't want to get COVID. Well, the alternative is much, much worse, right? So I can't stress enough. Our ERs are safe. As you come into Riverside ER, and Chris can speak to Amita, as you come in, you're going to get pre-triaged. If you have any sort of respiratory, you're going to go immediately into one of our isolation rooms. You're not going to be mixed with the other population of patients that are out there. We're seeing people dying at home. That is a travesty. We need people to come to the ER if you have symptoms of stroke, of chest pain, of shortness of breath. Get to the ER, guys. That's my whole theme here today. My biggest theme here today. We're set up for this. We have triage that will separate you from the COVID potentials. We have isolation rooms. We have all of that. We have PPE. We have all the stuff we need to take care of you safely within our emergency department. So please do that. The next thing I want to talk a little bit about is testing. And I believe testing is key as we want to come out of this self-quarantine, right? The stay-at-home orders. I believe, and this is Phil Campick speaking, I'm not a scientist, I'm not a doctor, I'm a healthcare administrator, but I know a thing or two. The more people we can test, the better off we're going to be. We have been doing a lot of testing at Riverside. We have the capabilities of doing 3,000 tests per week. Right? That's fantastic. 52 days ago when we started, we could do none, right? We would simply ask you, had you been to China? Had you been to Italy? Had you been to Iran or South Korea? And if you said no, but you had a fever and you weren't feeling well, stay home and self-quarantine. Those are the only tools we had back then. Last week, we got testing equipment on site. We can now do 3,000 tests per week. There's a standing joke with my team. I'm like, what happens if we do 299 tests in a week? We failed. I want 3,000 tests per week, guys. That's what we need to do. If we want to reopen back up, we need to test the community. We need to test the population. So what have we done at Riverside? Again, on May 11th, we're going to be able to open up elective procedures again. So again, our cardiac cath labs and our outpatient surgeries areas, our inpatient surgery area, et cetera, per the governor's executive order. And in my role on the IHA board, I worked with the governor's office, worked with IHA to have that happen. As that happens, we need to test every patient that's going to have a procedure. So we're going to test the patients that come in for a cardiac cath lab, to our cardiac cath lab. We're going to test folks who need surgery. We're going to test them before we do that surgery to make sure they're COVID negative. This week and last week, we've tested over 1,500 Riverside employees, right? We're testing our ER people, we're testing our ICU people, we're testing our cath lab people, we're testing our OR people. I want to make sure as patients come in, they're clean and our staff are clean. Our staff isn't going to transmit it to them, right? So we've tested over 1,500 people. We employ 3,000 over the course of the next few weeks. We'll test everybody else, right? But we know testing is key if we want to treat you safely. And so that's where we're working towards. What I will tell you is that any inpatient that comes into the hospital, anybody that comes to the hospital, they're sick enough where they have to spend the night. They have to stay overnight for a day or 2 or 5 or 10, whatever it is. We're testing all of those folks upon admission to make sure we can, if they're COVID negative, they have no symptoms, fantastic, they're going to go to a regular unit. But if they test COVID positive, then we're going to put them up on the isolation unit, right? Again, we've got to isolate this virus from each other. And that's the whole concept behind social distancing. That's what we're doing in our facilities as well. What I want to stress to the folks listening, to the entire community, it's safe to come to the hospital, right? We're going to test you. We've tested our staff. You need procedures. If you needed a cardiac cath 6 weeks ago, or if you needed a surgery 6 weeks ago, guess what? You need it today, right? We've delayed that. And probably, most likely, what we're seeing is if we delayed you 6 weeks ago, 4 weeks ago, and you've waited this long, you're probably deteriorating, right? That's just the natural human condition. We need to get you in. We need to get you tested. We need to take care of your issue so you can so you can continue on with your normal life and your normal routine. But testing is key, and that's what we're doing at Riverside. What I also want to say, you can read all the literature out there, etc., but our African American populations have been underserved across the country, right? A variety of reasons. But what Riverside has done, we went out to Pembroke Township, one of the poorest communities in the state of Illinois, and we offered testing out to everybody in that community. We got 233 people to come in and that we tested. So fantastic. We had people coming in. We did this on Tuesday. The results are back. We had 8 patients that were positive. Not that many. That's less than 3%. That's fantastic news. But those 3%, we need to make sure they stay isolated so they don't give it to grandma or they don't give it to their family member or to a community member, right? Because we've tested, we know we can isolate those folks for 10 days per CDC guidelines, and they're much less likely to then transmit it and perpetuate this and keep it going. Today we are out in Sun River Terrace, and I just got a note on my phone and some pictures. We were over 100. Hopefully we'll get up to that 150 level. But again, we're testing populations that are most at risk to help stop the spread, so then we can open up in the future, right? We have worked with various municipalities, with various employers, and we're going on the road, and we will go to your site and we will test you in those for those employee groups, for these communities, etc. I've got a team that is orchestrating and coordinating all of this. We're trying to get something going over on the east side of Kankakee, and I've had preliminary conversations with Mayor Wells, so we'll be doing that as early as next week. I'm a hometown Kankakee kid. I grew up over in Hobby Heights on the east side, went to Eastridge, so we're looking at setting it up there, but we have to work through a few logistics. We have a lot of employers that have reached out to us that we're going to go on site and start testing. So again, for me, my standpoint, testing is key to say, where are we at with this? For individuals, you can go to your primary care physician. They know now, we've communicated with them. They can send you to Riverside and you can get tested as well, right? So again, my goal, I would love to see at least 50% of everybody in this county tested. Maybe more, create more work for you, John, but that's what I'm looking at doing. How do we test as many people so we are ready to open our doors when the time comes and the governor lifts his order? So very positive. I'm taking way too much time, so I apologize, Chairman. The last thing I want to talk about, again, when all of this started, we said shut down the no visitors, no people coming into the hospitals. If you're sick, stay at home because we don't want you coming into the ER. Those were the messages that we sent, right, wrong, or indifferent. It was a different time. It was 52 days ago, right? Seems like an eternity now. We need to change that narrative. People need health care. People need to get their condition taken care of. They need to get their illness taken care of. So we are starting to open up at Riverside. We will open up visitors a little bit more, right? And I put myself in the place of a average consumer. If my loved one, if my wife or my child or whoever is going to come in for surgery, do I want them there by themselves? No, I want at least to be with them. So we are going to, with constraints, we are going to let visitors come in to those patients getting a cardiac cath or a outpatient surgery, etc. One visitor per patient. They will have to be masked up and they will have to get their temperature taken. We're taking everybody's temperature as they come into the hospital. So we're doing it safely. We're doing social distancing in our waiting rooms. So we're starting to roll that out now. Same thing with the ER. We're going to be opening up if your loved one's in a car accident, right? What are you going to do, Rob? You're going to be okay sitting outside? No, but we've had to do that up to this point. What we're going to do now is that we're going to let one family member in with their loved one in the ED as well. So again, we need to slowly start to reopen. That's all within guidelines. People are going to have masks on. They're going to get their temperature taken, but we need to be a kinder, gentler healthcare system and start easing up on some of that stuff. Same thing with our physician offices. What the caveat to this is our long-term care facilities. We are still going to enforce no visitors. We're still testing all of our employees as they come in. Again, those are the areas that are most at risk, long-term care, and then with those asymptomatic people. So lots of stuff happening. There was a article in the Daily Journal on video visits, so appreciate the Journal getting that out. People are still uncomfortable. You can do video visits to our primary care physicians as well. So we're trying to accommodate in any way we can to say, people get sick. People have accidents. People have heart disease. People have chronic conditions. We need to take care of those folks. That's our mission at Riverside, and we need people to start coming back into the hospital before it's too late. So with that, I will end my comments.
Thank you, Phil. I appreciate that. And you know, the next up is Chris Schride from Amita St. Mary's with his take and his report on what's going on over there at St. Mary's.
Good morning. Thank you for this opportunity, Chairman Wheeler. Hello to all those listening or streaming this. My name is Chris Schride. I'm president of Amita Health St. Mary's Hospital. My hope today is to provide some insight into one organization's perspective of how we're doing, what has been occurring behind the scenes within your local hospital, and where we're headed. On the front end, I do want to acknowledge, I do recognize, while it is hard for all of us, for many in our community, it is really hard right now. Each day I'm learning more how those in our community are struggling. And for me personally, I just have a senior at home who's missing graduation, a family going stir crazy, and I, like many of you, really need a haircut. So to update you on what's going on at St. Mary's, know we've been addressing COVID since the very beginning. Actually, the second COVID case in the United States was actually tested and admitted in one of our Amita Health hospitals. Since that early time, our local and system leaders have been working alongside the CDC and IDPH to learn together, and it's learning how best to approach, to treat, and test for this disease, as well as to institute best practices to keep our patients, our associates, physicians, and community safe. From the start, St. Mary's has been providing testing for COVID, and we've been utilizing the highly reliable PCR test. We've also always been supplied with sufficient personal protective equipment, or PPE as we keep referring to it. And we've been meeting and exceeding all CDH and IDPH guidelines. These strengths are why have been significant to our success during this time. Additionally, even as our total hospital services have significantly slowed down, St. Mary's has kept all of our staff employed and paid. In turn, we've added benefits to address their special COVID-related needs and work diligently to keep them and their families cared for and safe. We feel like by caring for and loving our own staff, we also help strengthen and care for our community. And our staff and physicians have reciprocated by performing in an outstanding way. I could not be prouder to work alongside these hosts of healthcare heroes and leaders. The St. Mary's family has simply been amazing during these times. You can be extremely confident in the great work that they've done. For example, with regard to testing, St. Mary's is providing outpatient COVID testing in a safe and separate annex from the hospital for over 40 days now. Across the 19 Amita hospitals across the Chicago region, there's been 16,000 total tests completed. Of those being tested, the negative rate, meaning those who have not been found to have COVID, has been hovering around 72.5% within Amita Health as a whole. Testing locally at St. Mary's has hung around 88.5% negative rate. So now understand, while we are testing individuals who have exposure risk or showing symptoms, so this is not the percentage that's representative of the whole community. We've been consistent both historically and today, and going forward, because of the lack of test kits across the country and the state, we're focusing on testing those who have had exposure or who have been symptomatic and at risk, as opposed to testing broadly. Of those testing positive at St. Mary's, only 25% have needed hospitalization and have been admitted as inpatients. Proudly, as of this morning, St. Mary's has celebrated 19 of those patients who have recovered from COVID complications and been discharged home. Across Amita, we just crossed over the 1,000 mark and have celebrating 1,100 COVID recoveries. Now, these have turned into meaningful, joy-filled celebrations within our hospital. We have music, staff cheering, and a big send-off as patients are received by their families to go home. It's been a unique blessing to experience these special reunions and see how God has worked through our physicians and our staff. While we have been and continue to be well prepared to help see our community through this pandemic, we, like you, look forward to safely reemerging from this healthcare crisis. We are currently working with a large interdisciplinary team of physicians and experts across our health system for reemergence planning. And this includes restarting essential procedures, surgeries, and even elective procedures, as Phil has referenced. Following IDPH and our governor's guidelines, we're taking into consideration all factors to allow for safe stage reopening of all services in the near future. Importantly, St. Mary's is fortunate to keep sufficient PPE and testing kits, allowing us to maintain strict protocols and protections for our patients and staff. So alongside the leadership of an amazing set of local physicians that we have, Amita Health St. Mary's Hospital is committed to the care and health of Kankakee County, and we are grateful for the trust our patients place in us. So if you're feeling ill for any reason, as Phil was saying, please call your doctor or come into the emergency department. We take every precaution to keep you safe while in our care. In fact, our physicians, both primary care and specialists, including our psychiatrists and cardiologists, are able to remain connected with you through virtual visits, so you can speak to them safely and in the comfort of your own home. Our goal is to provide our community the timely social distant care that you need. So to conclude, we are thankful to be a part of this Kankakee County Coalition for Responsible Reopening. We will continue to work with community leaders to help guide, encourage, and promote the safety and well-being of you and your family. And know without a doubt, and this is important, God is working in our neighborhoods, our businesses, and our homes, even in these strange and difficult times. So through your diligence, discipline, patience, and caring, which is displayed and acted on in new and creative ways to your neighbors and family, God is making things grow. As we prepare for the sunshine this weekend, I encourage each of you to plant a seed of kindness within someone's life in Kankakee County. Thank you.
Thank you, Chris. The next up was John Beavis from the Kankakee County Health Department to share some current information trends, anything else that he feels appropriate. Thanks, John.
Good afternoon, everyone. Good morning. I would like to, my name is John Beavis. I'm the administrator for the Kankakee County Health Department. Very early in this, our main role will be the investigation of the outbreak. So I know traditionally lately we've been doing a lot of the daily numbers, updating the public on our website, on our Facebook, and then working with a number of the agencies within the county and the state in regards to providing the most up-to-date information that we have on the COVID-19 situation here in Kankakee County, how it relates to everybody, and we will continue to do that. So, and I do have some numbers that I can go, but the main thing that I wanted to talk about this morning is that currently As Phil was alluding to, the more tests that will be done, we applaud that. That's what needs to be done. The more we test, the more we learn, the more we'll grow in dealing with this COVID-19 situation. So, but the more tests that we do, then ultimately we will find more positive cases. So that will create more work, obviously, for the health department with its main role, as I said, as the investigatory agency here. So obviously, individuals who are sick, who need to go to the hospital and receive treatment for anything, that will be handled by the hospitals. But when we determine that we have a positive case through a test of COVID, then ultimately the nurses at the Kankakee County Health Department are responsible for contacting that individual, and either through that individual, if they're able, or a family member, they get an interview. And so if we have a positive case, it can take about 1 to 2 hours to get a hold of that individual and start to ask the questions that we need to ask. And through that process, there'll be some questions. There's a lot more, but typically it'll be just like, where do you work? Do you have family? Who's your close contacts? And then we try to figure out who were those close contacts within that period of time. And then ultimately, for each positive case, we are averaging about 3 to 5 contacts, close contacts of individuals that we need to reach out to in addition to the positive case, and start to ask them potentially, are they having symptoms? Do they need to be isolating or quarantining at home too? And then we will follow those 3 to 5 contacts for approximately 2 weeks. And as they recover, then they drop off the list. And as we collect new ones as we go along. So currently today and for the past number of weeks, and it's ironic that you kind of referred to Phil as in the old days, 52 days ago, kind of a thing, but we learn so much every day. Things change almost constantly here. And so what we were doing on day one is completely different than what we're doing today, which may be completely different from what we're doing next month. However, that being said, we have 300 to 500 phone calls a day that my 4 CD nurses are having to do in terms of the contact tracing for the COVID cases. So we can manage that. That's something to do. And we have incredible staff at the health department who are working long hours and overtime and on weekends. And we have people who are jumping up to help as we've curbed some of the other traditional services that we're doing on a day-to-day basis. So for example, the hospitals for a while weren't doing some of these surgeries and things. They were put on hold. But now as so we've done that at the health department. We're screening individuals when they come in. We're only doing those essential services per the governor's orders. And so we have some people who can traditionally do other things that are helping with these contact tracing calls. However, as we start to normalize at the end of May and going into June, as they start to take away some of these restrictions and we get back to the new normal, those workers will go out and start to do what they need to do, and we'll still be doing the contact tracing then. So hopefully, as we move along here with the positive cases that we get, we'll see that we're maybe not stagnant, that's not the word, consistent, and maybe more manageable numbers, so that as of right now, I'm not saying that the health department's in any kind of danger. We're able to maintain and do what we need to do. But just realize the numbers don't magically appear at the end of the day on the website that this is how many cases we have. There is a lot of work that's going on both at the hospitals, at the testing sites where these tests are being done, and not only are the hospitals doing testing, but there are also some private laboratories out there now that are getting involved with the rapid testing. And so all those results come into the health department when they're positive, and then we have to process those. So there's a lot of work involved. And then through that, on a daily basis, provide you through our website, through our Facebook, through our social media, Twitter and Snapchat. I believe that we're getting ready to institute that. We can put a lot of information out there that the state is putting out there. And then the health department from the very beginning and continues today has been working closely with both the hospitals, with all the government agencies, with the state health department. There are just numerous meetings. Most of us probably have 3 to 5 meetings a day, and they seem to average about an hour. It seems to that seems to be the new protocol. Everything everything's an hour anymore. But we are constantly meeting to discuss this current situations, what's the new guidance, because this is not just Kankakee County where this is going on. It's going on everywhere throughout the state, throughout the country, throughout the world. So we're looking at what others are doing. They're looking at what we're doing, and we're all learning and growing together. And so we just ask that, secondarily to the investigation that we're doing for the COVID-19, we will put out the best available current information that we can for the public, going on the radio a couple of times a week. We're doing interviews with the paper. People can get the information the best way that they want to. And then we're just asking then and pushing out this information. Social distancing is working. We're seeing that. So I know, we're seeing that there's some people, you're frustrated. I'm frustrated. But it's working. And maybe I feel great and I think I don't need to be wearing that mask. Why do I have to do this? But ultimately, maybe I've already had it. I don't know. Or maybe I'm asymptomatic, as Phil and Chris said. But you have to be thinking about, well, am I going to visit my grandparents this weekend? Am I going to visit somebody else that I could pass this on to, and then they get severely sick or possibly even die as a result of my being negligent and just, could I have worn that mask while I went to the grocery store, kind of a thing. And I have to say, I'm seeing great things within our community. Everyone out in the stores, and these were the things that the health department and the hospitals, the medical professions, we preached even before COVID-19. If you're sick, you should be staying home. When you're sneezing, you should cough into your elbow. You should wash your hands often. These are things that will help protect your health and help prevent you from causing somebody to get sick when you're already not feeling good, whether it's seasonal allergies or it's the flu or a cold. So these are all things that we know. And I have to say that I feel like now the community is getting it, so that as we start to process ourselves later into the month and towards June, and the new norm is going to be that people understand now what social distancing means to help protect themselves, their family, their neighbors, and definitely the most vulnerable here in relation to COVID. Lastly, then I would just like to say currently, as of last night with our website, we were at 383 cases, 28 deaths, and we have 99 recoveries. So at some point today, I believe we're going to, if we haven't already, somebody's going to get to be that 100th recovery. That's all positive news. We seem to be moving in a positive way. So even though we are continuing to see positive cases, those are numbers we expected to see. As this is a virus, it's going to spread around. But we do feel that maybe that first major crazy rush is over, and we are at a place, hopefully, but I can't promise that we can continue to work, and definitely with the hospitals and all the agencies working together. We've been managing personal protective equipment and getting that handed out. We've got a drive going today for senior citizens for masks that are being handed out. As Phil alluded to, we've got the testing that started this week and is going to be continuing, so we can reach out to other communities. We've got other agencies getting involved with the testing, so more and more is getting out there. So as he said, 52 days ago, it seems like a year for me. It's just hard to believe that we went from zero to where we're at today, and here we are. But Kankakee, you're doing a great job, and all the agencies that we're working with are doing a great job.
Oh, thanks, John. That's good information. Moving on next is our county coroner, Bob Gessner, had some information to pass along on COVID-19 from his perspective. Most times unfortunate, so we hopefully might answer some questions people have on a regular basis that I hear. So.
Well, hello to everybody. Also, my name is Bob Gessner, Kankakee County Coroner. As of 9 o'clock this morning on May 1st, there has been 29 COVID deaths in Kankakee County. A death is considered a COVID-19 related when the primary physician or the coroner uses as a cause of death or a contributing condition to the death. To this date, physicians have signed 27 death certificates, and myself has signed 2. Of the 29 deaths, 100% have other document medical history. Okay, for instance, they could have died from the COVID, but they also had pneumonia, or pneumonia secondary. A is pneumonia, and then B could be COVID-19. Under the care of 35% of the deaths have been under the care of hospice. 59% of the deaths have occurred in long-term facilities. The average age is 79. The youngest we've had is 48. The oldest has been 94. There's been 13 males and 16 females. 86% of the deaths are Caucasian. 10% of the deaths in the county are African Americans, and 4% are Hispanics.
Thank you, Bob. I appreciate that. And while there's no joy in those numbers, I hope the public actually understands, you know, and connects some of those dots to the other information that you're hearing right here. That, you know, we want to keep those numbers lower. As we get more positive tests, you'll see that go up, but the goal is to keep that number, the numbers you're talking about, low till we can reduce that mortality rate. And so, yeah, appreciate it, Bob. Thank you so much. And at this point, I wanted to talk a little bit about what, you know, the county proper is doing. You know, the health department is a offshoot of the county. It's not necessarily under the county's management. You know, that's John and his board that manage that, but we try to be the vehicle to get information out, to coordinate, to get everybody on the same page. Really it's really nice to have you guys because we can implement your practices within our county government as from an HR perspective. So we do have an ace in the hole, so to speak, of somebody who knows what they're doing as an educational tool. So we do appreciate that. But a lot of times, to that point, our businesses and our citizens don't have that resource within their facilities. So, you know, the big factories, you know, the industry in town, they have an HR department, and they were like you know, where I'm at, and we saw this, and we're dealing with it 52 days ago, and we have hundreds and hundreds and hundreds of people to deal with, so you have to implement those practices right away. And some of our smaller employers, ones that may be not open right now, are going to need those resources as they reopen. And part of what we had talked about, and we all hear it if you watch cable news channels, which I try not to because it's frustrating, but is it a U-shaped curve or it is a V curve? And in Kankakee County, what can we do to make it a V instead of a U? And so that was one of the reasons that I thought the public could use an update from the hospitals and the health department, obviously the coroner, to provide some local perspective, but also to tell people that it's time to start getting our collective act together as far as coordinating and building for when we do reopen. We want to hit the ground running, and so that's why today I wanted to announce at least the formation of the Kankakee County Coalition for a Responsible Reopening, as Chris alluded to at the beginning, led by the health community, but facilitated by the county, so we can get everybody together on the same page. And we'll need people of particular skill sets from the community, people that are, you know, professionals. Maybe it's HR people, maybe it's you know, the just community members who are very active, like I mentioned, Steve Hunter and Mr. Pace before, people that are able to come to the table to bring actionable information and training to these businesses as they start to look at reopening and how to do it safely, how to do social distancing within a restaurant environment when they can reopen. What are those best practices? It's better that we do that now instead of waiting until we are open to have that happen. So in that aspect, really anybody and everybody that has a contribution is welcome, because as I'd mentioned before to somebody else, you know, sure, we need the professionals, but we may need a graphic designer and a webmaster to help us put a website up and get some posters out there. We may need somebody who goes to, who's doing online church meetings as it stands right now, that it spreads the message throughout their entire community. So it's really all hands on deck on how and when we go back to work as a community, because there's a lot of people hurting out there. How do we do this the right way to turn that U into a V? And so we're still, you know, it's still going to be a factor after June 1st. COVID-19 will, and it will be until a cure or a vaccine are found. And so, you know, obviously that's if you look at what people are saying, it could be, you know, a shorter time period on one and a longer time period on another, and we just don't know yet. It's one of those variables. As I said, educate businesses and public on how to operate in a COVID-19 world, because it's just not going to stop if everything reopens. We're going to have to deal with this as we engage the public from the county's perspective and other businesses. And what are our shared values with regard to protecting ourselves and those at risk in our circle, you know, whether it is at home, at work, or business. So we need to make sure that we're all on the same page and we provide real actionable information. You know, because we definitely know what we should be doing, and we are doing what we should be doing, and we need to keep that up. So we got to continue to promote proper CDC recommended mitigation techniques. We got to be ready to open up our economy, ensure that our recovery again is a V instead of a U. And this coalition is community leaders. I've reached out to some mayors. I'm going to get to the rest of them shortly, and hopefully they're watching this. They can reach out. They know how to find me. But there were, you know, most were, I think everybody was excited about being part of that initiative in some way within their community. And so if you haven't heard from me, you will be. You know, I said industry, professional services, HR people. Shoot me an email at awheeler@k3county.net. And if you want to participate, and I'll start to organize those names. And this is going to be quick here. We're going to start getting going. I have to talk with part of this, the initial group here that's getting it going, what their scheduling is, but obviously there'll be Zoom meetings. We're not going to go to a park and stand, you know, 6 feet apart and yell at each other. So we can't have 50 people obviously doing this, but like I said, everybody can play a role. So we look forward to that participation, if you will. So how we use electronic media, how we use digital, print and everything else to get the messages out. That's a focus here, and the group will actually develop what their processes are going to be and what their focus is. I don't have a predetermined notion. Those are just obvious things that we may get in the room and say we need to do X, Y, and Z to do for the end goal of, you know, making sure that we're ready to go when this thing reopens. So as it stands now, I'm saying that date is June 1st until it's not. And, you know, so that's a target to hit, you know, and we need to make sure we're as ready as possible. So as I said, I know our people are hurting physically, monetarily, and really psychologically. It's tough. There are bad days here. They're long days and sometimes not a lot of joy in what we're doing. But hopefully those pain points have worked, you know, to get us to this point of steadying, I guess is probably the best way to put it, and look into what we can do in the future. So with that said, I'm also, you know, based on the information I'm getting from healthcare professionals, is the county is going to reopen the county building here at 189 Court Street on May 11th, the same time that the hospitals are able to do all the electives and everything that they were talking about. You know, it's time that we get back open full time here at the county. It's been really a positive experience. People made those appointments. They did as much as they could online. People learned, you know, as a silver lining, that a lot of business can be done online. And I think there was some allusion to that in other comments. Is you know, people have picked up, I think it was yours, they picked up that, hey, you know, we can do a lot online, and these Zoom meetings they're working for us, and maybe we need to have a hybrid of that when we do get back to normal. So, you know, we definitely want the public to know that we're going to open back up. Please use the electronic media as we talked about. Call ahead, get questions answered. You know, if you're just looking for something to do to get out of the house, don't come down to the county building, you know, and because sometimes that's what it is. They come in and, hey, you know, I really don't understand assessments. What is that? Well, that's something you can pick up the phone and call. We want to give the information, but there's really no reason to put yourself and others at risk to do that. So, so our employees are going to be required to wear a mask, as will the public. The public's going to have to bring their own mask into the county building here. And I want to be clear, I'm not speaking for the courthouse or any other county building. It's just the one at 189. The sheriff and the chief judge have their own policies in their facilities. So want to make sure that's clear. And all employees that interact or work in this building will be given a baseline COVID-19 test, and that's happening next week. So everybody, whether it's shared janitorial services that go between buildings, couriers, you know, we want to try to make sure we have a good baseline indication of where we're at here, to, you know, for our own knowledge and for the public's knowledge as well. But again, if you walk in and you don't have a mask, or you come in and you're sneezing and coughing, we're going to turn you around, you know, and send you out. And all businesses know that you have that right. So because it's just not what we should be doing right now. Even if it's not COVID, you should not be around other people. It's just, I don't want to say not common sense, but It just needs to happen. And I say that because it has happened. I have people making appointments to come in, and they're obviously sick. And so, you know, there are some disconnects, but we really haven't seen that in the last couple of weeks. That was when we first started this. So we're going to practice the CDC recommendations within our offices, obviously, as we go back to full staff. And people need to do as much county business via the internet as I mentioned. So call ahead to the recorder, assessor, clerk, county clerk, that is, treasurer, planning department. If you need permits and things like that, get as much done ahead of time so that you're not spending a lot of time waiting in a line. And be prepared, because the treasurer is going to be getting a hold of everybody about tax payments, because obviously when people come to pay their taxes, there's long lines. We're also going to have the temperature is going to be tested for everybody coming in the building, employees and the public. So it's just much like the courthouse. We're going to do that here as well. And thanks to the sheriff for arranging a volunteer to take care of that for us. So as I mentioned, the silver lining is we are getting used to doing a lot electronically. Even those that were doing it before realize that they can do it even better and save themselves time and embrace it for the most part. So the next part is because we're the legislative body in the county, pretty much the top tier, if you will. You know, obviously the villages and cities have their own purview, but you know, we're the ones who get a lot of phone calls about, you know, why aren't we opening? And, you know, I understand there's going to be a protest down here today in front of the county building. That's for the press. So if you're not doing anything after lunch, maybe grab a Jimmy John's and pull up a lawn chair. But most people, and this is what I have to tell people, because I'm not here to make political stances, but I do need to draw a differentiation between what we're doing here at the county and what everybody else should be doing. Most people, I think, and including the governor, know that neither I nor the governor has the constitutional authority to close or reopen a private business outside of the businesses that require a license, like healthcare and salons and, you know, things like that. But that doesn't mean these recommendations or mandates, as you so call them, do not carry great value, and that we need to continue these best practices. So when I say that, is I'm taking them as recommendations, things that we should be doing and have proven that have worked, and we should not stop. Whether it's now, June 1st, or even until there's vaccines and you know, some type of a cure, a mitigation device. What do they call that? Prophylaxis?
Prophylactically.
Okay. Yeah. There you go. I'm playing a doctor. I just today. But I do urge our governor to consider the fact that outside of Cook County, we're not children to be given rights to. We look forward to having a respectful dialogue about what's best for us here in Kankakee County. You know, my guy Ben Franklin said, those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. I think that's a balance. So to those that say the governor does not have that authority, I absolutely agree with you. But I strongly urge you to continue to practice what has obviously worked up until this point. Being smart of your own free will should be enough. And so I'm taking steps to prepare the responsible reopening of Kankakee County businesses. And while I'm doing that, I'm reopening the county offices on Court Street on May 11th, and I welcome a well-coordinated Kankakee County tailored planning team that should include the support of the governor, our governor. There are 101 other counties in Illinois outside of Cook County, and one size does not fit all. So with that, that's just so the people that call me know exactly where I stand. I agree. There is no authority to really enforce, but that doesn't mean it's not the right thing to do at this point. And so with that being said, and that's from my personal opinion and my viewpoint. So with that being said, I would open it up to any questions, whether it's from the, start with the press in the back. If you guys have anything directly.
Jeff Monty from the Daily Journal. This is to you, Andy. Have you received many phone calls or any phone calls from concerned citizens that are business owners that want this county, to open up this, the businesses again?
Absolutely. It's whether it's a phone call, it's an email. Yeah, I get those phone calls. I get board members who want to do the same thing. And my answer is that. I said, I agree with you. I want to be open for businesses. I don't want to wait till the end of the month. I want this to be done responsibly, but I reiterate, I don't have that authority. You're born with rights, inalienable rights, life, liberty, pursuit of happiness. I don't think the governor has that authority either. But that, as I mentioned, I tell them we still need to do what we're doing because we're not done yet. And we're going to have to do it after we're open. So we need to do it methodically is my answer. They're hurting and I get it, believe me, and don't like it. Yes.
So are you saying that if a non-essential business were to reopen, that the sheriff's not going to do anything about it?
I don't speak for the sheriff, to be honest. So you'd have to ask him that question. So all I'm saying is that I agree with the philosophy, but sometimes we don't operate on philosophy. Sometimes we operate in reality.
Do you know anything about unemployment numbers in Kankakee County right now?
The last numbers I got were the end of the month, last month, and I knew we were right in the middle of the pack for the state of Illinois. So March numbers were, we were seriously right dead in the middle. And we had a 600% increase, like 3,000 applicants. I don't know where we're at for this month. Those numbers should be coming any day. So.
The county finance committee met yesterday.
Yes.
I was just curious of where the county stands financially with what we're going through with the COVID.
Sure. The one blessing for the county is if this would have happened 3 or 4 years ago, we would not just be on short staff, we'd be closed. Because we, and Bob knows this, and even John knows this, we were $15 million really in debt and leverage to the hilt with borrowing, and we had built up $1.5 million surplus at the beginning of this year, and we were going to have $3 million surplus in our general fund. But that's whittled away when your revenues are off, and there are so many unknowns. We try to put together the financial puzzle, and then, as I tell people, you get a couple pieces of the puzzle in the mail every day, and then they ask for 4 back. And then you have to start from the outside instead of the inside of the puzzle, and then it's a different picture. So we know what the knowns are, but we have enough in reserve to be able to go, and that's what the finance committee voted on, was how far do we go backwards before we have to take any corrective measures. And if you were to tie a number to a time frame, I think we can get with a U-shaped recovery through June. But then that's kind of where we're at. But again, will sales tax be way down? Or because people are doing Grubhub and restaurants and all of that kind of stuff, that's more tax than a grocery store. Will it balance out? Will income tax go down because people are out of work? It's so impossible to say right now because those numbers don't come in for 3 months after they're done. So we have so many variables. It's where we're at, but we're okay for right now. Other municipal governments, they're hand to mouth just like we are. School districts, everything else. I can't. Most people are cash poor these days in Illinois, because the state sends less money to you to cover off their mandates.
I do have a question for the coroner, Bob. I don't know whether you could tell me, at this point in the year, where are we in total number of deaths as compared to recent years? I don't know if you have those numbers available right off the top of your head. Okay. And Mr. Beavis, if you could answer for me, we're entering the time of the year, and we talked about this a little bit ago. We're entering the time of the year where we'd be seeing the end of the flu season, and I wondered if we know, and any of the health professionals that wanted to chime in, can we expect something similar from COVID? Are we getting to the end of what might be a COVID season?
That's a good question. Not sure. Current school of thought I'll when I'm done, I think Phil maybe could address this. I know we talked about this a little bit before the meeting started. Current school of thought for traditional viruses would be that typically as the warmer, humid seasons come into play, you start to see a decrease. People are, kind of inadvertently social distancing. They're outside more. They're more spread out. Doing athletic activities, what have you, and gardening, things like that, and so you traditionally see a drop in the occurrence of those types of things. So that's possible, but with this being a novel new virus, there's not enough specifically for it. But if it were to come after, we learn more and more about it, that traditionally if it is continuing to act like a virus, that may be the case. I'll turn it over to Phil there at that point.
Now you're going to get me in trouble. I'm an eternal optimist. And again, there, as John said, there is so much new information coming out as we do more testing, as more studies come out, et cetera. The school of thought 52 days ago was no, temperature doesn't matter. It's not going to impact it at all. I've seen some more recent studies. They're saying, yeah, it is now starting to behave more like a typical flu, and that as the weather and the humidity and the heat comes up, it'll start to decline like a traditional flu virus. But John is absolutely right. We just don't know. More and more studies are coming out. I know just from what we're seeing, it seems like it is slowing down, or that we're peaking, or we have peaked for Kankakee County. The state is another story, and they have different numbers, et cetera. I'm just looking at what we've seen here, and it seems like we have peaked, or we either just have, or we're getting ready to, and we're seeing it start the slow descent. My hope is that it does act like a normal virus and does start to burn itself out, and we'll have a reprieve at least until the fall.
If I believe from everything we read and hear, everything is a guess to that answer. And the more you speak to people with infectious disease expertise and the scientists, the more skeptical they are. So I don't know the answer, but I do know it's very, very gray at this time. And the higher the level of expertise, the more skepticism they have that they have the answer.
This is for Chris and Phil. What are your staffs like right now? This has been tough. And I was just wondering, from the doctors, the nurses, all the way down to housekeeping, are they in good spirits, and what are you doing to?
Yeah. And if you don't, I'll take it first, I guess. Chris had mentioned this in his comments, and I failed to, so I apologize to my team. Just incredible. We have just incredible healthcare workers in this community, and at Riverside, I'm biased. I say there's none better. They have been troopers, whether it's at Riverside Medical Center, whether it's at Miller, whether it's at our senior living centers. Staff have risen to the occasion. I love this community because that's what I see time and time again. When the chips are down, when a disaster hits, people pull together, and our staff are no different. They have just done a wonderful, phenomenal job. With that being said, I will thank the community as well. Yesterday I came in and got my temperature taken like everybody does every day, right? And there were Dunkin' Donuts out there in little bags, individual bags, and they donated Dunkin' Donuts and coffee. So everybody that came in that day, the local Dunkin' Donuts franchise donated. We get that all of the time. I was talking about the command center. I'm sitting there, and all of a sudden they're bringing in plate after plate of this homemade bread. A lady out in the community baked all of this bread, it was fantastic, and brought it in. We took it up to the units and we took it up to the departments, but the community has been fantastic, and that really does help our staff, right? It's just incredible, the community outpouring, the nice things that people are doing. Monocle's Pizza, Harry Bond is the owner. They gave us everybody an individual coupon for an individual pizza. But there's a story after story after story of people doing that. I have a Cubs mask, right? So, yeah, exactly. Forget about those White Sox people. But this was made by one of our volunteers, right? The volunteers are out there making these masks. They know I like the Cubs, so they made me my own Cubs mask here. But the community has been fantastic. That helps elevate the spirits of our staff. And our staff, again, are wonderful. They've done a great job. They're holding up. They're seeing a light at the end of the tunnel, right? We're not there yet, but we're seeing a light at the end of the tunnel, and we're excited about that as well.
Any perspective?
Yeah, I think there's kind of two parts to that question. You have one is how they performed, and they performed really well. So the rising up of leaders, we've got a host of folks that who have in their areas risen to leadership. They may not be in management, but they've risen and really performed well. And so as a team, this has, as Phil was saying, when people get pressured, you find out what their character are, and they've performed really well, and it's been amazing to see. But that's one part of it, and then the next is kind of your question of how are they feeling, and it's difficult. We have many areas they feel very pressured, and then you have other parts of the hospital who they're trying to find something to do, because we're paying them, and they're like, well, what am I going to do? And so we find, there's obviously within a COVID world, we have different needs. So we've been adjusting to that. So while they feel pressured, what I've been really impressed with is culturally how there's still a sense of joy, of family, of coming together. And I think it's kind of represented when we talk about when we have discharges of COVID positive patients and people surround and cheer. It's kind of a nice release, but I think culturally it's been very impressive to see that not only have they risen up in their work and their competence and abiding by a lot of different and adjusting rules, because to keep people safe, which we've done, there's a lot of rigor around that and diligence, and they've done that, but they've also done it with a spirit of compassion to the patients and families, and to one another. And so culturally, I've had a couple people from our system ask me that, and I've said, walk around, talk to the physicians, I won't answer it for you, talk to them. And I have a lot of confidence that you're going to hear people that feel good. They've been supported, they've been cared for, they've been given what they need to do their job correctly. And we continue to train as we adjust. So I think from that, we've been able to bond together. So it's been pretty impressive.
Right. So, and by the way, if you have a phone number of the bread lady, let me know. I'm sure Mr. Beavis would like that as well.
Making me hungry
I'm just
now.
kidding.
I have a question for John. Can you tell us if out of the positive cases, if they've been multiple members of families that have been involved?
Is this one on?
Yeah.
Yeah, I feel comfortable at this point. I know early on, especially before we were being able to test, as Phil and Chris have alluded to, early on when we tested one person and they tested positive and were told to stay at home, if within the close contact investigation it was determined that, say, a family of 4, then those 3 others were presumed to be positive and being asked to isolate at that point too. So in many cases early on, 52 days ago, as we keep alluding to, we did have that. Now with more testing, we are starting to see, husband and wife combinations, boyfriend girlfriend combinations, family member combinations, kind of a thing. What exactly those numbers are, I don't have those off the top of my head, and really it doesn't matter. But obviously if Phil and I were brothers, for example, and we lived within the same home, we'd be within close contact of each other. Obviously, if one becomes positive but the other one hasn't, maybe he was asymptomatic and gave it to me, or it's possible I could still give it to him. That's what we just don't know yet. That's why we still need to maintain these social distancing guidelines and practice this, what we're preaching, so that with the other family members or people that I interact with in the community that are vulnerable, that are out there trying to buy their groceries or get their services, that we don't infect them and get them sick.
Follow up, John. Have any of the people that tested positive retested positive at all?
I'm not aware of that.
Okay.
I'm not aware of any in this county that we've been involved with that have done that.
Just from I have a question. What about antibodies testing? Where's that in the whole circle of things? Where does that come in? What does that help? What are they saying? When is it?
Right, from my perspective, right now, it's very inaccurate. And so Riverside would have the capability of doing it, but we're not, because it's so inaccurate, the testing that's been done out there. it's going to give you a false sense of security, a false negative or a false positive. So I'm not supportive of that at this point. And I tell my board members and I tell the community members that eventually they will get it right and they will develop the reagents and the testing that's going to be much more accurate. And the COVID testing that we're doing specifically is 99.9% accurate. We know if you have it or you don't. The antibody testing, the best I've seen is in that 70 percentile range, and that's just not good enough. Why even waste the time to do it?
Do you have any perspective?
Yeah, I would agree that it's not far enough along to trust it, but there are, Mayo has a national program, we're participating in it, where we're collecting plasma, and it is to get to the point of having have a product and having the science and data behind it to trust it. So we have even had a local patient who's already been a donor to that, and we're doing it across Chicagoland, but even here locally, we're participating.
Sure, good. Any other questions? Okay, we have a couple on the phone. No, I'm just kidding. Well, we want to thank everybody for tuning in. Obviously, you have more questions. You know, the county looks to the health department to be our point of information. We all funnel information, so check with them, check their Facebook, check their website for updated information. The coroner's website also has information on the unfortunate cases that you would see.
Every day.
He's updating every day, so you know, if you do want to take a look at on how some of these the people who did not that passed because of the disease, then he would have information on those types of statistics on there as well. So thanks everybody, stay safe, and all we can say is keep doing what you're doing because it's working. Have a good day.